when I first met Dr. Chu, I found him, he's remarkable. I mean, I owe a lot to him, and he materially changed my life. He looked at my case, and instantly he said, we need to get you to a lower level of medication so you can function daily. I went to school at Montana State on a football scholarship and came out and was not drafted, but ended up signing a contract with the Green Bay Packers, and spent over a period of 7 years, spent it with the Green Bay Packers up until the point where Coach Starr was let go, so they had a change in coaches who came in. So I ended up moving on, and the USFL was starting up back in the early 80s. So ended up with Memphis Showboats actually for 2 years till the league folded. They won the lawsuit against the NFL, but it was $1, and so the whole league folded. So from there I went on and signed. I picked the Chicago Bears and was able to get a free agency agreement with them. They had just come off the Super Bowl, and I thought between Houston and San Francisco, the best shot I would have is to play with the Chicago Bears, and it looked like they were still very competitive at that point. So that was after a number of different injuries back in 1988. My body wasn't holding up enough to be able to compete and still play, so I retired at that point. After retiring and having the injuries, a lot of the injuries that I have some were able to be fixed short term, but as I've found out, they also can linger in, way after you're done retiring. So over the 7 years, I had broken my wrist and I had 5 different surgeries. So I had 3 knee surgeries, my elbow surgery, which prevented me from even straightening my arm. And then I ended up with low back surgery. It's, being one of the smaller centers in the NFL, and you're going up against Reggie White and William Perry, the Fridge, and he's, at his size, it took a big toll on your body. So that was really, I've been fortunate enough to try to have injuries fixed, but up to that point, I was able to have surgery, everything would be fine. So that's where later in life, and starting in 2021, as I was starting to have other issues with my feet, I had, felt like I was walking on rocks underneath my feet, and then I've had a lot of twisting of my toes. I felt like somebody was twisting them, and eventually it started to migrate up throughout my body. And so some of the symptoms, in 2001, I went to Vanderbilt, and they diagnosed me of having neuropathy. And after that, I went to Emory Healthcare down in Atlanta. They have a really good medical university down there. Similar, they ran through a lot of other tests, but they diagnosed it as being small fiber neuropathy. And with that, my wife and I decided to keep pushing and learning more, see other ways of treating it. And so I went to the Mayo Clinic up in Rochester. So they ran an extensive series of tests, confirmed I had a severe case of small fiber neuropathy. And that is really what's kind of led me to the point starting in 2021, and here we're in 2023. And I was at a point, it was impacting my life materially. I mean, I couldn't function. All 3 of the medical universities prescribed heavy medication. And with the heavy medication, it was at such a level I could not, it sounds comical, but on a business trip, I could not pack my suitcase for a 3-day business trip. Just the heavy loads of medication, and it's there to help block the brain signals, because small fibers or tiny nerves, when they get damaged, they send false signals. And it can be to the point of your skin is burning throughout. I was having electrical jolts going through my brain, through my elbows, when my legs would just fire off. So it's a severe case, and having the fact that my only alternative at the time was taking heavy medication, we continued to push and find, is there alternative treatments that are out there that you can have? And ultimately, our family physician, and then my brother, who is also a physician, recommended trying to find a pain consultant or pain management center that can help and maybe look at alternative treatments. And that's where my first start was with Dr. Chu over at Pain Consultants. He also recommended a spinal cord stimulator. And a spinal cord stimulator, actually you have wiring that some patients only need it from the lower half. Others, like mine, you have 2 wires and a generator implanted or a battery pack in your back. And it's there to help all those signals from your tiny nerves are sending false signals like your skin's burning, and the spinal cord stimulator can help manage that. It kind of helps interrupt those false signals that you just tore your Achilles tendon, or you have a hamstring pull and then the next day you don't. So having that and finding out that there was alternative treatments like that, it's been remarkable. I still have symptoms, but they're at a level where my quality of life, I can still work, I can still function with my family and friends and being able to drive. So I really found Dr. Chu is just absolutely remarkable. And I felt so fortunate we have that to find somebody who cares about us. He's very smart and intelligent, but he really tries to listen to you, and then lays out, the options that you have and the pros and cons with it. And so far, he's not only with the small fiber. I've had some other past NFL injuries that are showing up in my lower back and right hip, and same thing. He's just been remarkable of being able to identify it, be able to share with me pros and cons of each treatment, and been a remarkable help. So quality of life absolutely is so much better. Meeting with Dr. Chu and the diagnosis or the treatment that he recommended was a spinal cord stimulator. And then he also recommended, let's get me down lower on some of the pain medications, which allowed me to function even more. From there, I do meet with him quarterly, once a quarter, and sometimes sooner that if I have any other things that come up. But playing football, there were some other injuries I had with the right hip and my lower back. So he's been working with me and using steroid injections to help me manage some of the issues I have in my lower lumbar area between L5 and S1, which is close to where I had that former procedure. So some of that is catching up with age. Some of those things are finding their way as I'm learning that some of the lower back and hips don't hold up like they used to. So he's been wonderful. And I will say this, when we first came in for the very first day, meeting Dr. Chu, but also his staff, it's just been a remarkable experience. They're friendly, they're open, they're detailed, and a lot of times Dr. Chu, he will explain everything, he'll lay everything out, but his staff is very supportive. They follow up with any information you need proactively before an appointment and afterwards. So it's been good. Their new facility is remarkable. So I've had 3 procedures done in their outpatient surgery center. So those steroid injections, for my back and my hip area, and it's a beautiful facility. But those people in the back that help and assist with the operations are well trained, and they all take interest in you as a patient. So the experience has been wonderful. Besides the advice and recommendations and helping me from a pathway of getting better, it's nice to know that you have people that really care about you. So I think that's something you don't necessarily find every day. If other people are experiencing, symptoms, neuropathy is becoming very, very pronounced. It's becoming more and more. There's an awareness. There's a site that you can actually, and my wife's been wonderful of researching the site of patients that have neuropathy, and you can hear the very similar symptoms. Some are more severe, some are less. But I think the underlying thing we're learning is that don't stop with if I had stopped with just taking heavy medications that Vanderbilt and Emory and the Mayo Clinics had, I'd be in a difficult spot. So keep pushing, get second opinions, keep driving what's the latest technology, do your research. That's the biggest thing I can recommend is do your research. If you hear something, then check it out and either get a second opinion from another doctor before taking any steps. And what you learn is medicine seems to be a science, right? It's not, so you can have different doctors provide different recommendations. So I think that's the biggest thing is find somebody you're comfortable with, but keep pushing, keep doing your research, look for alternative treatments, which we did. There was other things out there, acupuncture, wave therapy, some other things that we explored, but ultimately we decided to go with Dr. Chu and his recommendations.